The recent Kisumu County holding their maternal perinatal death review meeting called the MPDSR meeting, a lot of key findings came out, and we are finding out that the 5 maternal death killers that we have in Kenya needs to be addressed. We are talking about postpartum hemorrhage, we call it excessive bleeding. We are talking about the high blood pressure. We are talking about obstructed labor, infections, and also unsafe abortion. Case to point out that is most alarming in Kisumu County is the postpartum hemorrhage and also high blood pressure.
In 2024, the county reported 36 maternal deaths, 2 of which happened in the community. The highest causes of maternal deaths for 2024 were PPH and eclampsia, with eclampsia contributing about a third. That is, out of 3 women that died, 1 was caused by eclampsia. PPH also contributed to about a quarter of all those deaths. That means about 4 women that die, 1 is PPH, attributed to PPH. So altogether, PPH and eclampsia caused about 60% of all maternal deaths in the county. That basically means out of 5 women that die, 3 are caused by a combination of PPH and eclampsia. Causes that which we can intervene with the available resources and also the skills. The occurrence of these complications, especially PPH and eclampsia, is 67%. If you add with the obstructed labor, then that would be 94%. When we come to neonatal deaths, we lost 453 children to known causes, especially majorly prematurity and asphyxia. 50% of all those neonatal deaths were attributed to prematurity, while about 45% asphyxia. If you combine the two, that is prematurity and asphyxia, then 94% of children of neonatal deaths were caused by the two. The trend is worrying. Although for the maternal death there's been reduction from 2020 to date, there's been considerable reduction in those maternal deaths, but when it comes to neonatal deaths, there's a worrying trend of increase from 2020 to 2024.
As KMET, one of the key partners that is supporting the county, we have various innovations that we can be able to support the county with to avert these preventable deaths. Some of the key innovations that we have is 1, our community engagement, where we are really educating on the need for focused antenatal care visits, and we are also ensuring that when the women go to the facilities, they can be initiated on the malaria drugs at an earlier stage. They can be provided with the nets and they sleep under those given nets. We are also having initiative at the facility level, where for us we are looking at OPOCAS, so that the women can be checked early in case of any fetal abnormalities, or in case in terms of their health outcomes, we can be able to avert those health outcomes. We are also looking at the use of ACPatograph, where for us we are also training the healthcare providers to monitor the fetuses and also to monitor the mother, so that during labor the mothers can be able to deliver safely. Last but not least, we are looking at also the facility preparedness, where for us we are looking at a bundled approach. With the bundled approach, we are looking at everyone within the facility to be able to provide quality care to this mother while in labor and after delivery. So here we are looking at the non-clinical and the clinical team be able to support this mother, especially when they are having postpartum hemorrhage.
Interventions need to be applied and be invested in these facilities, so that all facilities and all providers are able to manage these complications and also neonatal, both maternal and neonatal complications, to avert these deaths.